Have you ever paused before scheduling that surgery in your 70s or 80s, wondering if your body will bounce back like it used to, or if the anesthesia will leave you in a fog that lingers for days? As we age, our reactions to procedures change in ways even doctors don't always highlight. Slower healing, heightened stress on the heart and brain, and recovery that can steal your independence if you're not prepared. But what if I told you that with the right knowledge, you could turn those risks into a roadmap for coming out stronger, more confident, and ready to reclaim your life? Stick with me until the end, because I'll reveal 5 game-changing strategies that protect your mind, body, and peace of mind, including real stories from seniors who shaved weeks off their recovery and walked out feeling empowered, not exhausted. Strategies that could be the difference between a setback and your best comeback yet. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Anesthesia and how your body responds after 70. One of the most critical yet frequently overlooked aspects of undergoing surgery after the age of 70 isn't the precision of the surgeon's scalpel, the careful placement of stitches, or even the advanced technology in the operating room. It's the anesthesia that puts you under and brings you back. The instant you drift into unconsciousness, your entire body transitions into a profoundly vulnerable state, almost like flipping a switch that dims your natural defenses. The way it rebounds from this altered reality hinges on a delicate interplay of factors: your chronological age, the cumulative toll of your lifelong health history, any underlying conditions like heart issues or diabetes, and, crucially, how meticulously your medical care team customizes the dosage and type of medication to your unique physiology. For older adults, the body's processing machinery, particularly the liver and kidneys, which metabolize drugs, operates at a reduced efficiency compared to younger years. This means that even a routine, standard dose of anesthesia can circulate and persist in your system far longer than anticipated, leading to a recovery phase that's not just extended but often laced with unexpected hurdles, such as prolonged grogginess or fluctuating vital signs. What might take a 40-year-old just a couple of hours to shake off could stretch into half a day or more for someone over 70, turning what should be a straightforward wake-up into a gradual, sometimes frustrating climb back to baseline. The brain, that intricate command center, is especially sensitive to these shifts, and its reactions can be among the most disorienting. You've likely come across stories or warnings about postoperative cognitive dysfunction or, more commonly, delirium, a term that sounds clinical but feels anything but. This isn't mere forgetfulness, like misplacing your keys after a long day. It's a dense, temporary mental fog that envelopes your thoughts, often emerging in the hours or even days following the procedure. Symptoms can vary widely from person to person. Some individuals report a profound sense of disorientation, as if they've woken up in an unfamiliar world, struggling to piece together where they are or what just happened. Others might experience waves of unusual fatigue that weigh them down like an invisible blanket, heightened emotional sensitivity where small frustrations spark tears or irritability, or even bouts of agitation that make them restless and unsettled in their hospital bed. Importantly, this isn't a sign that the surgery went awry or that your doctors missed something catastrophic. It's simply your brain's way of signaling that it requires additional time, gentle prompting, and supportive care to fully recalibrate after the chemical detour. Factors like dehydration, pain, or the sterile hospital environment can exacerbate it, but with proactive monitoring, it usually resolves on its own. Still, understanding this possibility up front can ease anxiety and empower you to advocate for yourself. That's precisely why initiating a candid conversation with your anesthesiologist well before the big day is non-negotiable. Don't rely solely on the assumption that they've pored over your electronic health record or that their standard protocol will magically align with your needs. Medical teams are stretched thin, and personal details can get lost in the shuffle. Schedule a dedicated pre-op consultation if possible, and come armed with direct, thoughtful questions that cut to the heart of the matter. Based on my age and health profile, what specific type of anesthesia do you recommend? General, which puts me fully under, or something more targeted like regional or local? How long do you estimate it will take for the effects to fully wear off in my case? And are there any safer, lighter alternatives, such as reduced dosages or nerve blocks, that could minimize risks for someone in their 70s or 80s? These aren't intrusive or demanding inquiries. They're a vital form of self-advocacy, a shield that protects your well-being and ensures the plan is tailored rather than templated. Let me share the story of Gerald, a spirited 78-year-old I once knew, who was facing a routine hip replacement to address years of arthritis that had turned simple walks into painful ordeals. He'd navigated surgeries in his younger days, a gallbladder removal in his 50s, for instance, but wisdom from those experiences taught him not to take anything for granted. This time around, he proactively requested a sit-down with the anesthesiologist a full week before the procedure. Together, they reviewed his medical history, weighed the pros and cons, and opted for a spinal block, a targeted injection that numbs the lower body while keeping the upper half alert and breathing independently, instead of the full general anesthesia that had left him foggy and nauseous last time. The surgery went smoothly, and within just an hour of waking and recovery, Gerald was remarkably alert, cracking jokes with the nurses, inquiring about the score of his favorite team's game, and even requesting a hearty lunch of scrambled eggs and toast. "It was night and day," he later recounted with a grin. "I felt like myself from the get-go, no haze, no struggle to string sentences together. It made the whole hospital stay feel less like an ordeal and more like a pit stop." Of course, not every surgical scenario lends itself to such alternatives. Emergencies or complex abdominal procedures might demand general anesthesia for safety reasons, but you'll never uncover those possibilities without posing the question. Equally vital is transparency about your past. Inform your team immediately if you've ever experienced adverse reactions to anesthesia, no matter how distant the memory. Whether it was severe nausea, allergic swelling, or prolonged confusion from a procedure decades ago. Even faint echoes from youth can influence today's choices, prompting adjustments like pre-medication to prevent repeats. At the end of the day, your age is indeed just a number on paper, but when it comes to how your brain and body metabolize potent medications like anesthetics, it carries profound weight. Selecting the optimal anesthesia strategy isn't merely a technical footnote to the surgery. It's the linchpin that determines the texture of your emergence. How swiftly you regain the sharpness to converse with loved ones, the steadiness to sit up without vertigo, the appetite to nourish yourself, and the mental clarity to chart your next steps. In the golden years, when resilience isn't as boundless as it once was, those initial hours of lucidity aren't a luxury. They're the foundation. A smooth awakening cascades into momentum, fostering mobility, reducing infection risks, and accelerating the journey back to independence, while a rocky one can ripple into extended stays, heightened dependency, and a steeper emotional toll. By prioritizing anesthesia wisdom, you're not just enduring the procedure. You're architecting a recovery that honors the vitality you've cultivated over a lifetime. Number 2. How pre-surgery preparation shapes your recovery. When navigating the landscape of surgery after 70, it's all too easy for patients and families to zero in on the high-drama centerpiece. The day of the procedure itself, with its flurry of pre-op checklists, 4 lines, and countdown to the operating room. Yet, the true game-changer often lies in the quieter, more proactive prelude, the 2 to 3 weeks leading up to that date. These unassuming days represent a golden window of opportunity to fortify your body against the impending physiological storm, priming it for resilience rather than reaction. Seniors who invest thoughtfully in this pre-surgery phase, often dubbed prehabilitation or prehab in medical circles, tend to reap tangible rewards. Swifter healing timelines, a marked dip in complication rates like infections or blood clots, and a profound sense of agency that transforms the entire experience from overwhelming to empowering. Among the most underappreciated pillars of this preparation is nutrition, a silent powerhouse that fuels the microscopic miracles of repair at the cellular level. As the decades accumulate, sarcopenia, the gradual, age-related erosion of muscle mass, becomes a stealthy adversary, quietly sapping strength and prolonging vulnerability to postoperative weakness, balance issues, or even falls during early rehab. But you can counter this with intentional dietary tweaks in the lead-up weeks, ramping up protein consumption to 1.2 to 1.6 grams per kilogram of body weight daily, as recommended by many geriatric specialists. Think nutrient-dense staples like fluffy scrambled eggs for breakfast, hearty bean-based soups or lentil stews at lunch, flaky grilled fish or poultry for dinner, and convenient boosts from Greek yogurt or low-sugar protein shakes sipped between meals. The goal isn't caloric overload or dramatic overhauls that strain your routine. It's strategic fueling that jumpstarts collagen production for wound closure, bolsters your immune system's vigilance against opportunistic bugs, and preserves lean tissue to keep you mobile sooner. Studies in geriatric care underscore this. Well-nourished patients often shave days off their hospital stays and report less fatigue in the weeks beyond. Sleep, that restorative elixir we all crave but often elude in later years, emerges as another linchpin, amplified in urgency by the surgery horizon. Fragmented or shallow slumber is a common thief for those over 70, exacerbated by medications, joint discomfort, or the mind's nocturnal wanderings. But in the pre-op countdown, quality Z's become a non-negotiable asset. Your body orchestrates its deepest repairs, hormone regulation, tissue mending, inflammation tamping, during those uninterrupted cycles of deep sleep, so skimping here is like sending an undertrained soldier into battle. To reclaim rhythm, establish a consistent wind-down ritual. Aim for the same bedtime each night, perhaps 10 p.m., dimming lights an hour before cueing melatonin release. Banish screens whose blue glow disrupts circadian cues, and weave in daytime anchors like morning sunlight exposure or a brief afternoon nap capped at 30 minutes. If anxiety about the surgery nibbles at your rest, simple techniques like progressive muscle relaxation, tensing and releasing each limb from toes to scalp, can quiet the chatter. The payoff? Entering the OR with a recharged nervous system means less postoperative insomnia, quicker pain threshold recovery, and a sharper edge for decision-making amid the haze of meds. Movement, too, warrants a starring role, even if your baseline activity level skews toward the sedentary. The beauty of prehab lies in its accessibility. No marathons required. Incorporating gentle, consistent motion, such as 10 to 15-minute strolls around the block, seated marches in place while watching the news, or easy yoga poses like cat-cow stretches to loosen the spine, yields outsized benefits. These low-impact efforts enhance blood flow to extremities, fortify lung expansion to ward off atelectasis, collapsed lung tissue, and prime the cardiovascular system against clots that love to form in stillness. Moreover, they build a buffer of endurance, making the inevitable bed rest post-op less deconditioning. Healthcare providers increasingly champion structured prehab programs, complete with personalized guides from physical therapists, recognizing that it's not reserved for elite athletes. It's a democratized toolkit for fortifying everyday warriors against the rigors ahead. Consider Helen, a vibrant 76-year-old with a zest for gardening that belied her upcoming abdominal surgery for a hernia repair. Her surgeon, attuned to geriatric best practices, handed her a straightforward pre-op playbook. Amp up protein via daily smoothies blended with spinach and nuts. Commit to 2 15-minute walks daily, rain or shine, and practice diaphragmatic breathing, inhaling deeply through the nose for 4 counts, holding, then exhaling slowly, to expand lung capacity and dial down stress. Helen embraced it with the discipline of an old habit, tracking her progress in a bedside journal and enlisting her daughter for accountability walks. When the day arrived and surgery wrapped without a hitch, the recovery ward buzzed with praise. Nurses marveled at her rapid mobilization, shuffling to the bathroom unassisted by day one. Her blood pressure and oxygen levels held rock steady, sidestepping the dips that plague many, and she breezed through with minimal opioid demands, opting instead for ice packs and light movement. I approached it like training for a garden marathon, Helen reflected later, her eyes twinkling. Those small daily wins built my confidence, and I swear they got my feet, and my spirit, back under me faster than I could have imagined. Don't overlook hydration, that humble hero of homeostasis. Unless contraindicated by conditions like heart failure, aim for 8 to 10 glasses of water daily in those preparatory weeks, infusing with lemon or cucumber if plain H2O bores you. It lubricates your kidneys for efficient drug clearance under anesthesia, maintains supple skin and mucous membranes to thwart cracks or infections, and even blunts the edge of common side effects like dry mouth, lightheadedness, or queasiness upon emergence. In essence, these pre-surgery choices, a deliberate protein portion here, an extra hydration sip there, a mindful stretch under the morning sun, aren't flashy or burdensome. They're the incremental investments that compound into resilience. When the moment arrives to cross the hospital threshold, you're not arriving as a passive participant burdened by what-ifs. With fortified muscles humming efficiently, a balanced internal ecosystem humming in harmony, and a mind steadied by preparation's quiet confidence, you're stepping forward as an active architect of your story. You're not merely crossing fingers for a favorable roll of the dice. You're stacking the deck with science, intention, and the unyielding human capacity to adapt, ensuring that recovery isn't just survivable, but a pathway back to the life you cherish with renewed vigor. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 3, the medications and supplements you take matter more than you think. By the time you're 70 or older, it's almost a given that you'll have a small arsenal of pill bottles neatly arranged on the bathroom counter or tucked away in a kitchen drawer. Perhaps a daily regimen for managing blood pressure, another set of tablets to keep cholesterol in check, and maybe even something to ease those restless nights or soothe the aches of arthritis that seem to creep in more insistently with each passing season. And that's not even counting the vitamins, minerals, and supplements that so many of us pop religiously, often on the advice of a well-meaning friend or a glossy magazine article promising a boost in energy or immunity, just in case. Before you know it, what started as a simple routine has ballooned into a full-fledged personal pharmacy, complete with prescriptions from the doctor, over-the-counter remedies grabbed during a quick errand, and those colorful bottles of herbal extracts lining the shelf. Yet, here's the eye-opener that catches so many off guard. Not all of these familiar allies are as benign as they seem when it comes to undergoing surgery. In fact, some of the most routine ones can subtly sabotage the procedure itself or throw a wrench into your body's delicate healing process in the days and weeks that follow. Take blood thinners, for instance. Whether they're heavy-duty prescriptions like warfarin or the everyday over-the-counter staples such as aspirin or ibuprofen that we reach for at the first twinge of a headache or muscle strain. These can ramp up the risk of excessive bleeding during the operation, turning what should be a controlled incision into a potential floodgate. Then there are those seemingly innocent herbal supplements, the ones we tout as natural alternatives drawn from the earth's bounty. Ginseng for vitality, garlic for heart health, or ginkgo biloba for sharper memory. While they may offer gentle benefits on ordinary days, they can mimic the effects of blood thinners in the operating room, thinning your blood just when you need it to clot reliably. And it's not limited to bleeding risks. Other supplements can meddle in even more unexpected ways. See, John's wort, popular for lifting moods during those gray winter months, has been known to interact unpredictably with anesthesia, potentially altering how your body processes the drugs that keep you safely under during surgery or manage pain afterward. Even the humble fish oil capsule, prized for its omega-3s and promises of joint lubrication and cardiovascular support, can tip the scales toward prolonged clotting issues, delaying the formation of those crucial protective scabs. The list goes on, from vitamin E, which acts as a mild anticoagulant, to certain weight loss aids that might spike your blood sugar levels at the worst possible moment. This isn't meant to instill fear or make you second-guess every capsule you swallow. Far from it. It's purely about fostering a deeper awareness, empowering you to approach surgery with eyes wide open rather than stumbling into hidden pitfalls. The good news? Arming yourself with knowledge is straightforward and proactive. The moment your surgery date is locked in on the calendar, compile a comprehensive inventory of absolutely everything that crosses your lips or touches your skin as part of your daily ritual. We're talking prescriptions straight from the pharmacy, those OTC pain relievers and antacids you keep in the medicine cabinet, every vitamin and mineral supplement in your lineup, even the less obvious ones like protein powders stirred into your morning smoothie, eye drops for dry eyes, nicotine patches if that's your vice, or topical creams for skin conditions. Scribble it all down on a single sheet of paper, or better yet, snap photos of the labels for quick reference. Include dosages, frequencies, and how long you've been on each one. Don't fall into the trap of assuming your surgeon or the pre-op team has a crystal ball into your medicine cabinet. They don't, and relying on a hurried mention during a consultation might not cut it. Nor should you passively wait for the intake nurse to prompt you with a checklist. Take the reins instead. At your very next appointment, hand over that list and declare with confidence, "This is my full daily lineup. Prescriptions, OTCs, supplements, the works. Based on this, is there anything I should pause, reduce, or tweak in the lead-up to surgery?" This isn't nagging, it's savvy self-advocacy, a small gesture that can avert complications lurking just beneath the surface. Things like unexpected hemorrhaging, adverse reactions under anesthesia, or a sluggish wound closure that extends your hospital time and recovery drag. Let me share a real-life snapshot to bring this home. Consider Frank, an 81-year-old retiree with a spirit as robust as his morning coffee, who'd been faithfully taking a turmeric supplement for years to keep his knee inflammation at bay after decades of weekend hikes. The golden powder, derived from that familiar kitchen spice, had become his go-to for taming flare-ups, and he viewed it as harmless. After all, wasn't it just a flavorful addition to curries? He never gave it a second thought until his routine shoulder surgery loomed on the horizon. During a casual chat with the anesthesiologist in the pre-op clinic, Frank offhandedly mentioned the turmeric. The doctor didn't bat an eye but advised halting it 2 full weeks before the knife, citing its potent curcumin content, which can inhibit platelet function and heighten bleeding risks in much the same way as some pharmaceuticals. The surgery went off without a hitch, and in the weeks that followed, Frank's recovery was remarkably steady. No excessive bruising, no frantic calls to the ER over oozing incisions. Reflecting over a cup of tea, he confided, "I figured it was nothing more than a spice from my spice rack, something Grandma used in her stews. But that quick conversation. It might have spared me a recovery that dragged on with stitches popping or blood work every other day." Who knew? Timing, as it turns out, is everything in this equation. It's not a one-size-fits-all pause button. Some culprits, like nonsteroidal anti-inflammatories, NSAIDs, or certain antidepressants, might need to be shelved for a full week or more in advance to clear your system. Others, such as beta blockers for blood pressure or medications for chronic heart conditions, could be greenlit to continue right through to the morning of surgery, perhaps with a slight adjustment to the dose to maintain stability without courting chaos. Your surgical team, surgeons, anesthesiologists, pharmacists, relies on that unfiltered intel to craft a bespoke safety net, tailoring the anesthesia cocktail, monitoring protocols, and post-op meds to harmonize with your unique health symphony. And let's not forget the wildcard additions. Those spontaneous starts prompted by a neighbor's glowing testimonial, "This new herbal tea fixed my digestion overnight." Or an intriguing online forum post that led you to snag a bottle of echinacea from the health food aisle for immune support ahead of flu season. Even the most wholesome botanicals can tango unpredictably with surgical drugs, from heightening sedation effects to disrupting electrolyte balances that anesthesia demands precision in. Honesty here isn't optional. It's essential. Lay it all bare without a hint of apology. Your doctors aren't there to judge but to safeguard. There's zero shame in admitting, "I tried this on a whim, thought it might help with the fatigue." In fact, that candor invites wisdom. Guidance on safe swaps, reassurance on low-risk items, or even alternatives to bridge the gap. Ultimately, this conversation isn't a call to dismantle your hard-won wellness routine overnight. Life after 70 is about sustaining what works, not starting from scratch. It's merely a temporary recalibration, a brief intermission to ensure the scalpel meets no resistance and your healing pathway stays clear. When your medical team holds the unvarnished truth, they can orchestrate a procedure that's not just successful on paper but seamless in practice, propelling you toward a rebound that's swift, steady, and blissfully free of curveballs. After all, in the grand tapestry of recovery beyond 70, the only truly harmless unknowns are the ones you never uncover, and who wants to roll those dice? Number 4. The hospital stay and recovery may be harder than expected, so plan for support. Here's a truth that's often whispered only in hindsight, after the beeps and bustle have faded. The hospital environment, with its perpetual fluorescent glare, the cacophony of distant monitors and hurried footsteps echoing down sterile halls, and the relentless rhythm of vital checks and meal trays at odd hours, can feel profoundly disorienting for anyone fresh out of major surgery. But for those of us over 70, it's amplified. Your senses, already attuned to the quieter cadences of home, clash against this unnatural symphony, while your body, still groggy from anesthesia and raw from the procedure, grapples not just with mending tissues but with reorienting itself in a world that suddenly feels alien and unyielding. Sleep fractures into shallow snippets, appetite wanes under the assault of 4 lines and institutional jello, and even the simplest shift in bed can summon waves of fatigue that pin you down like an invisible weight. It's this cumulative haze that leaves many seniors reeling, not from inherent frailty but from sheer unpreparedness for the emotional and logistical toll. What seemed like a straightforward in-and-out operation morphs into a multi-day vigil where confusion creeps in, pain ebbs and flows unpredictably, and the loss of autonomy, deciding when to eat, move, or rest, chips away at your reserves. And that's just the inpatient stretch. Transitioning home ushers in its own gauntlet. Tasks that were autopilot yesterday, swinging your legs over the bed's edge, navigating the 3 steps to the bathroom, or whipping up a sandwich for lunch, now demand Herculean effort laced with dizziness, stiffness, or the fear of a misstep leading to a tumble. Mobility aids clatter unfamiliarly, showers become logistical puzzles with grab bars and non-slip mats, and the kitchen, once a haven, looms as a minefield of reaching and bending. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. The silver lining. Those who emerge from surgery not just intact but invigorated are invariably the planners, the ones who anticipated these shifts and rallied a safety net before the first post-op ache set in. They don't wing it, they orchestrate. Picture enlisting a close family member to bunk down for the initial week, transforming the guest room into a command center with medications pre-sorted in pill organizers and a lifeline phone within arm's reach. Or tapping a reliable neighbor for daily drop-ins, a quick sweep of the floors to nix tripping hazards, a restock of the fridge with nutrient-dense, no-fuss options like pre-portioned soups or fruit smoothies that thaw in minutes. Proactive souls clear pathways of rugs and cords, install temporary nightlights along hallways, and batch prep meals in the freezer. Think hearty casseroles or salads that store effortlessly, ensuring that energy once funneled into chores redirects straight to repair. But support isn't solely about the tangible. It's woven with emotional threads that hold everything together. Post-surgery vulnerability hits hard and fast. That raw exposure where pride stings at needing assistance to button a shirt or sponge bathe in bed, where frustration bubbles up over the glacial pace of reclaiming your stride, and unbidden waves of melancholy or jittery anxiety wash over without a clear trigger, perhaps stirred by the scent of antiseptic lingering on your skin or the echo of hospital wheels in your dreams. These aren't signs of weakness, but hallmarks of a profound reset, your psyche catching up to the physical upheaval. And in those tender hours, it's the steady presence of another human, a warm hand on your shoulder, a shared laugh over a silly mishap, or simply the comfort of company in the quiet, that stitches the soul back faster than any analgesic. Take Carol, a spirited 74-year-old with a lifetime of solo adventures under her belt, from solo road trips across state lines to tending her victory garden through every season. Independence was her badge of honor. She loathed the idea of bothering anyone, envisioning her knee replacement as just another hurdle she'd vault alone. But reality intruded on night one at home. The throbbing in her bandaged joint kept sleep at bay, the crutches wobbled under her unpracticed grip, and a sudden pang of isolation made the empty rooms feel cavernous. Swallowing her reluctance, she dialed her daughter the next morning. "Could you swing by for a few days? I think I need backup more than I let on." What unfolded wasn't a frenzy of tasks but a gentle rhythm. Mornings anchored by oatmeal and easy chatter at the breakfast nook, afternoons laced with tentative laps around the living room carpet followed by dozy silences on the porch swing, evenings capped with a light supper and stories from the old days. When Carol later unpacked it all, her words cut to the core. Sure, the meal deliveries and laundry service were lifesavers, but what truly steadied me was that unspoken knowing, I wasn't adrift in this. Someone was there, seeing me through the fog. Even if family orbits a bit farther out these days, the landscape of aid is richer than ever. Home health aides can step in for skilled checks like wound dressing or PT sessions tailored to your pace. Senior recovery programs through local clinics offer virtual check-ins or group calls with peers who've walked the same path. And don't overlook community gems like volunteer networks from churches, synagogues, or senior centers, where folks trained in compassionate listening deliver groceries or simply sit with a cuppa, bridging the gap with warmth. Extending that ask isn't a concession to frailty, it's a bold affirmation of resilience, a declaration that you're prioritizing not just endurance but the full spectrum of well-being. Safety in motion, solace in stillness, and the grace to lean without toppling. As your surgery calendar page fills, resist settling for the rote hospital bag stocked with toiletries and slippers. Elevate it to a holistic recovery blueprint. One that blueprints people as much as provisions. Map out who'll handle transport to and fro, who'll field the midnight worries, and who'll celebrate the small triumphs, like that first unassisted shower. Because even the most iron-willed among us falter when healing demands surrender. And you, vibrant, vital you, merit a comeback wrapped in dignity, cushioned by comfort, and buoyed by the profound peace of solidarity. Not merely enduring the aftermath, but emerging renewed, with stories of quiet victories to share around the table once more. Number 5. Your mindset before surgery affects how your body heals. Among the myriad factors swirling around surgical prep after 70, from EKGs and enzyme levels to incision sites and 4 protocols, one stands out for its quiet potency, yet it's routinely overlooked: the landscape of your inner world. It's not about lab values etched in black ink or scans glowing on a screen. It's the subtle alchemy of your thoughts, emotions, and preparatory rituals that can either propel or impede your body's innate drive to mend. This goes beyond a superficial pat on the back with "think positive," though positivity has its place. We're delving into intentional focus, emotional attunement, and a grounded clarity that aligns your mind as a steadfast ally, rather than an unwitting adversary burdened by distraction, dread, or disquiet. Science is illuminating this interplay more vividly with each passing year. Studies in psychoneuroimmunology reveal how pre-surgical mental conditioning can dial down inflammation markers, fortify immune responses, and even recalibrate pain thresholds, sometimes trimming hospital sojourns by a day or two and easing the grip of discomfort without extra opioids. For seniors, where resilience is a hard-earned art, those who enter the OR with a demeanor of poised assurance, having mapped their apprehensions and marshaled their hopes, tend to glide through rehab with fewer hitches, reclaiming mobility and zest with a fluidity that defies chronological odds. Conversely, when anxiety festers unchecked, spawning a mental maelstrom of what-ifs or a sense of being herded into the unknown, it can manifest physically. Elevated cortisol floods the system, tightening muscles, disrupting sleep, and inviting setbacks like delayed wound knitting or amplified nausea, even when the surgeon's hand was flawless. So, how do you harness this? Begin by carving out a modest mental rehearsal in the prelude days, nothing grandiose, just consistent anchors to tether your spirit. Envision it unfolding gently each evening as you unwind. Close your eyes for 5 unhurried minutes and trace the arc in vivid strokes. The cool glide of the gurney, the steady cadence of your breath under the mask, the first groggy awakenings laced with relief as monitors hum softly. Or commit your aspirations to paper, distilling them into bite-sized beacons. By day 3, I'll circle the block with my walker, feeling the sun on my face. Or come day 4, I'll savor my eggs at the dining table, not from a tray in bed. These aren't lofty decrees but neural blueprints, priming your brain to anticipate progress, so when your frame lags, your resolve doesn't waver. It's already mapped the route. Layer in the liberation of voicing the shadows, that knot in your gut whispering, "What if I don't regain my old stride?" Or, "I'm terrified this will unravel the life I've built." For many in our silver-haired cohort, admitting frailty feels like tempting fate, a crack in the armor we've polished over decades of stoic navigation. Yet, uttering it, even in a hushed journal entry, a murmured confession to a lifelong confidant, or a direct query to your surgeon during rounds, dissolves its power, transforming a solitary specter into a shared narrative. You'll likely hear echoes. "Darling, I felt that too before my hip. It's the mind's way of bracing, but look at me now, dancing at weddings." That reciprocity. It's a bomb, shrinking the fear from monolith to milestone. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Recall Howard, an 80-year-old with the build of a marathoner and a garage workshop brimming with half-finished birdhouses, steeling himself for open-heart surgery to bypass a stubborn blockage. Physically, he was primed, cardio clearances stamped, lungs robust from years of garden tending, but inwardly, he was a tempest, second-guessing every heartbeat. Sensing the stall, he turned to a spiral notebook, committing just a trio of lines each dawn, raw admissions like, "Today's dread is the scar's permanence," balanced with glimmers such as, "Post this, I'll carve that oak rocker for the grandkids," and queries like, "What tune will I hum first upon waking?" It became his ritual, a dawn-lit dialogue that untangled the knots. When he emerged from recovery, tubes snaking away and color returning to his cheeks, Howard reflected with a wry grin. The graft took hold fine, and the PT was grueling as expected. But my body was playing catch-up. My mind? It had scouted the trail weeks ahead, flags planted at every bend. That foreknowledge turned the haze into horizon. Nor should we undervalue the sanctuaries of serenity. Those practices that coax the nervous system from its frantic fight or flight perch down to the restorative hum of rest and repair. A guided meditation app murmuring through progressive muscle relaxes, a prayer strung with gratitude for the hands that will guide the tools, deep diaphragmatic breaths traced to a count of 4 in, hold, 4 out. Pick your portal to pause, and let it ripple. These aren't luxuries but levers, flipping your physiology toward receptivity, where cells divide with efficiency and nerves signal with grace. In the end, striding toward the operating theater with a mind unfrayed, intentional, unburdened, quietly fierce, bestows upon your body the optimal canvas for its masterpiece of renewal. Healing, after all, defies compartmentalization. It's a symphony of sinew and synapse, feeling and fortitude. And the most enduring encores? They crescendo from that understated valor you bestow upon yourself. The deliberate whispers of preparation that echo long after the sutures dissolve, reminding you that at 70 and beyond, your greatest instrument for thriving is the one that never ages, the resilient, resourceful you. As we wrap up this journey through the 5 essential steps for facing surgery in your 70s or 80s, remember that knowledge isn't just power. It's the foundation for stepping into that operating room with confidence, clarity, and a plan that honors your body's wisdom. You've got the tools now to protect your independence, speed up healing, and emerge even stronger, because preparation turns uncertainty into empowerment. What have you learned so far that resonates most with you? Take a moment to reflect on these insights, and I'd love for you to comment below. Share one key thing you've picked up today and how you plan to bring it into practice in your life. Whether it's chatting with your anesthesiologist about options, boosting your protein intake pre-surgery, or simply journaling your mindset to stay centered. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more empowering advice on thriving in your golden years. Thanks for watching. Your stories inspire us all, and we'll see you in the next one.